Greg Masters at the Wireless Life Sciences Alliance Convergence Summit 2014 in beautiful San Diego, and my pleasure and privilege to speak with Dr. Leroy Hood, MD, PhD, who's the president and co-founder, Institute of Systems Biology. And this morning, after the keynote and introduction by Rob McCrae, the theme for the morning was curating for outcomes. You were the opening keynote. What'd you talk about?
Well, I talked about the fact that we're on the verge of a completely new type of medicine, predictive, preventive, personalized, and participatory, P4 medicine, I call it, and that we're creating a pilot project to examine in a longitudinal Framingham-like fashion 100,000 well patients over a period of 20 years or more, looking at 10 different measures 4 different times a year, and seeing that these patients will divide into 2 groups, those who remain well or get healthier, those who transition into disease. And with all of these data, we can examine in ways we've never explored before, both wellness, what it is to create metrics, and disease transitions, looking at the earliest origins of disease transition, with the hope in a relatively short period of time, we'll be able to change that disease trajectory back to a wellness trajectory and save the healthcare system enormous amounts of dollars.
Sounds like some important longitudinal benchmarking for this whole evolution and emergence of the personalized medicine space.
It is, and what's been very exciting is since we've announced that program, 7 countries have contacted me and would like to participate in similar kinds of programs. So we're setting up a franchise kind of operation where we exchange and share data, where we agree to standards both for sample collection and data types and so forth. And this means the initiative will spread to most of the continents of the world, and I think catalyze very quickly, not just looking at 100,000 people, but looking at millions and eventually hundreds of millions of patients in exactly the same way.
Where are you at in the launch trajectory here? Has this just been announced?
It's just been announced. We started the first 100 patients March of this year, and we're already well along into examining the first data and have convinced ourselves that our hypothesis that each individual will have multiple actionable opportunities to either improve their wellness or avoid disease is indeed going to be true.
So tell us a little bit about the Institute for System Biology. What do you do there?
The Institute was created in 2000. Its reason for existence basically was to use systems biology approaches to deal with the complexity of biology and medicine. So we develop new strategies for doing biology and medicine. We develop new technologies. We develop analytic tools, and we apply them to these very, very challenging problems.
Well, you're very modest here. It's noted that you were instrumental, if not the driver, in the development of 5 instruments critical for contemporary biology, namely automated DNA sequencers, DNA synthesizers, protein sequencers, and peptide synthesizers, and an inkjet printer for constructing DNA arrays. Tell us briefly about why are those all important? What do they do?
Well, those instruments basically brought, for the first time, engineering to biology. And what those instruments did collectively were 2 important things. It created a vision that you could generate high throughput data in biology, and it was the opening shot in creating big data for biology. And of course, the automated DNA sequencer was essential for enabling the Human Genome Project.
Wonderful. So, are you having fun here at WLSA?
I am having fun here at WLSA. I mean, I'll tell you, the people you can network here with is just beyond belief. People you've read about, you've heard about, and they're all excited about very common visions of how healthcare is going to change in the future.
And some have said this is the decade of validation, not show me the next new shiny object. Is that something we think might come out of this type of venue?
It will. I mean, I think a critical part of the vision I have is how one networks across the world, making readily available strategies, approaches, data, analytics, and networking is the center focus of all of the imperatives.
Well, there you have it. I've been speaking with Leroy Hood, MD, PhD, president and co-founder of the Institute for Systems Biology. Thanks so much for showing up today.
My pleasure.